Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and today I am interviewing Dr. Trevor Berry. We are going to be talking about low-level laser therapy. If you are unfamiliar with what this is, Bob is actually doing treatments for this with his condition, and he's seeing some good benefits from it. So we thought it'd be good to have on an expert explain what it is, how it works, and how you can try it at home. So without further ado, here is Dr. Berry. Well, welcome, Dr. Berry, to the podcast. Thank you so much for joining me today.
Great to be here. Thanks for having me, Mike.
So we are going to be talking about low-level laser therapy. And for our audience, that is a mouthful after a while. So we might refer to it as laser therapy, laser treatment, or just lasers. But just keep in mind, we're always talking about low-level laser therapy. How often do you have to say that in a day by chance?
Well, right, exactly. LLLT. And it's interesting because the verbiage that you'll see in the research and whatnot really gets intertwined because we'll dive into this a little bit, but like LED sometimes gets called laser and things like that. And so there's a lot of misnomer activity. But, the main thing to take home for therapeutic stuff for our purposes is low-level laser. Sometimes you'll even hear it as cold laser. But yes, low-level laser therapy is the best way to describe it. So.
Yeah, and oftentimes online I noticed it's always LLLT. So if our audience ever sees that, that's what we mean.
Exactly.
So we'll begin by you telling us a little bit about your background and how you became interested in laser treatments.
Well, my initial history, I went into, my pre-med and all my sciences, and then went into chiropractic was my foundation. And obviously in the field of chiropractic, there's a very strong philosophical tie into the brain-based rehab and things like that. But, there's a lot of questions that I still wanted answered that I didn't, I had a great education. But as I dove deeper, I want more answers to why, when you do things to stimulate the body, how does it affect the brain? What are the pathways? What exactly is going on from neurophysiological perspective? So then I branched off, went and got my neurology diplomate. I went through the Carrick Institute. And, I had a personal interest in practice, or a practice-based interest in brain-based stuff like concussions and things like that. And then, but you'll often hear me tell the story that further branched into with my ex-wife. We have two daughters, and they have their side of the family, the maternal side of the family, has a severe genetic predilection for Alzheimer's. So it further propelled my research and trying to understand what can I do to protect the brains and repair the brains, not only of my patients, but by my own family members and myself. And as I started to dive deeper and deeper into literature, I take a very integrative approach. I use functional medicine, functional neurology, orthopedics, chiropractic. So we do nutrition stuff, we do hyperbaric here, we do, neurofeedback. We come at it from all these different angles. But the one thing that really stood out for me was all the literature that was pouring in on neurological applications of low-level laser therapy. I mean, it was almost, irrefutable on how much this could to protect and repair the brain. It was almost like one of those too good to be true scenarios. So that's why I just kept diving deeper and deeper. And so people always ask me, like, if you only had one modality that you could use to protect and repair the brain, I would, without hesitation, I would say low-level laser therapy, because it checks off so many of the boxes that you need for the brain health that we'll take a deeper dive into today.
So for the layperson, or personally me sometimes, when I was in school, I remember we learned about red light therapy, we called it. I'm assuming there's a differential between the two?
Well, some of the laser, the biggest difference is light therapies as a standalone are scattered photons that go everywhere. So red light therapy could be something as simple as like an LED device. That's like taking a red light bulb and shining it. Are you going to get some energy of those photons into your system? Yes. But what laser is they take all those photons, that single little tiny thing that does all the work of light therapy, and they collimate it all in a parallel coherent waveform so that all those photons are working together. That's the difference between true laser and just red light therapy. So there's a place for red light therapies and different things. Like you go to these infrared saunas and different things like that. You'll see red lights and it has a therapeutic benefit. But true laser versus red light is a big difference. Like one of the things you'll often, just as a simple comparison, is that red light therapy, like LED, is what we use as a sham placebo in our double-blinded studies against true laser, just to give some context. So red light will have some minuscule benefit, but compared to true laser, it's like an apples to oranges comparison.
Sure, makes sense. So you work for a company called Erchonia. Would you mind telling where people can find out more information about them online?
Yeah. So actually, technically, I'm not an employee of Erchonia.
Oh,
I actually just love their technology so much that I attach my cart to their horse. Because when I was looking at
gotcha.
the safest, like arguably, like when I looked at, okay, what device is the most effective, most researched, safest device I'm going to shine on my daughter's heads, my head, my patient's head, it was very clear that Erchonia they were the industry leader on that. So what they did was they saw how I practice, and they said, hey, they saw me doing all this cool brain-based stuff with laser. So hey, will you come teach with us? And so I actually teach to how I practice, and I just bring all my band of merrymen along with me, all the nutrition companies, lab companies, laser, all that stuff. So Erchonia and I just became, inextricably linked to each other. So I do lecture for them. I do research for them. I love the company. They're a great company to work with. And so, that was kind of my origin of that. And it just branched into all these other, these projects that we work on. So, what was your original question?
Where can people find information about them?
So, if you go to Erchonia.com, I'm sorry, I knew there was something else in there. Yeah, Erchonia.com, that's ERCHONIA.com. They have all of their, their FDA clearance studies, the white papers on it. They have all their seminars. They've got a whole load of excellent speakers in the different arenas in medical and chiropractic and physical. There are all these different arenas that they do research and have applications. They have all their seminars listed. All their devices are listed on there. So yeah, it's a really robust site.
So if people want to find more information about you specifically, where do they go?
You can go to, look up my name, Google it. I've been doing a lot of, online stuff, podcasts, things like that, just trying to get the message out there. If you go to azchironeuro.com, that's azchironeuro. So my clinic is Arizona Chiropractic Neurology Center. So if you Google that, you'll be able to see our website, a lot of stuff I'm involved with. My information also from my lecture circuit and stuff is on their Erchonia site as well too. So.
Okay. So before we get into the questions, I just want our audience to be aware on the update on Bob video. The laser treatment he was using is what we are specifically talking about today. So there's a correlation there, and that's how we kind of got involved with this company. And so Dr. Berry was kind enough to hop on and explain it more to us so we can understand it.
Absolutely.
So my first question is, can you explain what low-level therapy is and how it actually works?
I think one of the easiest ways, without going into a 12-hour dissertation on light modulation stuff, it would be kind of think of it like the plant photosynthesis analogy. We're energy-driven beings, and so Western medicine has kind of indoctrinated us into kind of having that chemical mindset, with pharmaceuticals and biochemical interaction stuff. But really, especially the field of neurology, it's based on energy. If you can get energy into the system, it can do all kinds of amazing things. So a lot of times when I'm describing light therapies, I just describe that most people in grade school studied plant photosynthesis and how they need sunlight to create all these reactions in their well-being and their growth and how they thrive. We as humans are no different. We need light therapies. We need light. We need sunlight. And so you can tap into that light energy when you get energy into the system, it can do amazing things with optimization, like when I'm working with Olympic athletes and things like that, all the way down to, trying to wake up a neuron for, say, stroke rehab or for neurodegenerative changes. So one of the big principles that you will want to take home from light therapy is it creates mitochondrial output or increases mitochondrial output, which is your powerhouse. One of the big things with mitochondria, it's your energy producing component of cells. So when you think of Krebs cycle and ATP synthesis and whatnot, that's a big component. Getting that energy, the light gives you more energy to rehab and repair the body. Another big thing that's kind of all the way down, that's kind of a common denominator in a lot of stuff people are suffering from pain, neurodegeneration, autoimmunity, things like that, is inflammation. Well, one of the things that light therapies will do is it can tamp down and regulate all the different areas of inflammation, including the linchpin of inflammation, which is called NFKB, nuclear factor kappa beta. So if you can turn down inflammation, we need inflammation in acute stages of repair, but a lot of us are suffering from chronic inflammation, diabetics and autoimmune cases and things like that. So if you have ways you can turn down chronic inflammation, now you're going to hit a home run. Well, lasers can go after the interleukins, the COX-2 pathway, the NFK pathway, all these different inflammation pathways. Low-level laser can turn the dial down from that. So that's a pretty cool thing. All of your free radical stuff, all that oxidative stress that we're under as humans. Lasers have been shown to promote glutathione output, catalase, superoxide dismutase, all that stuff. One of the cool things that really is a big thing for me in the holy grail of brain rehab is that lasers that have been actually shown to promote biogenesis of cell activity, like neurogenesis. So actually new neuron formation, like stem cell stuff, lasers have been shown to promote that in brain and spinal cord research and things like that, and even mitochondrial biogenesis. So like new energy producing organelles, if you get that light at the right dose on the brain, you can actually promote neurogenesis, which is kind of like the holy grail of brain rehab. Because when your neurons go poof and they're gone, they don't come back. They're not mitotic. They don't turn over like a liver cell and things like that. Studies show that light therapies can increase gray matter and neurogenesis in areas like the hippocampus, like your memory center where dementia tends to start, for example, and even mitochondrial biogenesis. So making new mitochondria on tissue when you put the light devices on it. When you look at the major protein misfolds, that you see in neurodegeneration, like tau and amyloid, like that gunk that builds up on the outside of neurons in dementia, for example. Tau protein misfolds where neurons can't talk to each other. Lasers have been shown to actually stop that progression and even reverse it. In some studies, it's been shown for the anti-aging component, the telomere shortening. It's really almost sounds too good to be true. I say that because it's like all the major boxes you need to check for brain rehab and recovery. When you put a light device on the head, it can actually protect it and repair it. And that's why it's been shown to be effective in dementias like Alzheimer's, in movement disorders like Parkinson's and things like that. So it's a very nascent field. Obviously, we need a lot of research in these arenas, but it's super exciting. And so when people ask there's so many good things, it's almost too good to be true. Really, the major caveat is you have to stay in the Goldilocks effect. And that being that there are certain doses you want to stay below for brain and body applications where it starts to lose its efficacy, if you will. It starts to lose the positive outcomes. The magic number the audience wants to remember is that you want to stay below 10 joules per centimeter squared to the brain. I know that's going to sound Greek to a lot of the audience members, but there's dose calculators. So, to calculate laser dose, you almost have to have an MIT grad, but they do have dose calculators online. When you put in the power of the laser, the length of time, the beam width, when you put all those parameters together, if you're staying from about 0.005 joules per centimeter squared to 10 joules per centimeter squared, that is the sweet spot and what you want to do for safe and effective laser treatment to the brain and body.
When I was in therapy school, I remember having to learn joules, so I must have learned a little bit about laser therapy, but I didn't really use it in the clinics at all, so I didn't really do much of it.
Yeah, it is. It's like I said, I wasn't exaggerating. Got to be an MIT grad, but it's one of the reasons I like the low level companies, because one of the misconceptions is the low level laser has all this robust research backing it. Well, then the high powered lasers like the class 4s and stuff say, well, if low level's good, then ours must be better. Kind of that tool time Tim, more power the better. And you have to be very careful about that rhetoric. The higher powered laser companies don't actually have their FDA clearance as a laser. They actually have their FDA clearance as a medical heat lamp to heat tissue. And so they get clearance for like an elbow pain and things like that. And that, fine, use those devices for that kind of thing. And that's not what we're trying. We want true photochemical reaction with all these great, physiological things I've been expressing this today. And that's where low level is that's why you want to be in that power range, if you will. And that's when we like with Erchonia products, I could leave that on somebody's head for hours if I wanted to and not exceed my hormetic threshold. And that's why I have no issues with doctors using that on the brains of patients, even, with kids and stuff. We have an autism study in the pipeline, for example, and things like that. So, not all light devices are created equal, might be the major take home point for that. So stay in the low end of the spectrum, and that way with products like Erchonia, that way you'll stay in that safety width.
Do you want to show any of the devices that you have?
Yeah, so like the one that Bob, this is one of the handhelds. This is the EVRL, and I'll even boot it up so you can see it in action. So these are, and I've got one on you can put it on a stand, for example, and so that way you can like set it and forget it on a patient. Maybe you're working on a knee, on an elbow, on the head, whatever. This is the FX405 behind me. This is the scanning diode one. These are a little bit bigger lasers, but I'll turn this one on as well too, so you can see it.
I'll mention for the audio audience, you can find us on our YouTube channel to see the visuals if you're curious.
Yeah, so you can see here, these are scanning diodes that are rotating that covers more surface area. And you won't be able to see it quite as well on the video, but this one has a violet and red, and then these two are red. So this is called the FX405. Which means it's a 405 nanometer violet beam plus the red beams are 635, which we'll get into in a little bit here. And then, this one has this is the handheld and same kind of mechanism, but this has the diodes here. Sorry, I'm just turning this one on. So you can see here, going into, and maybe I'll do a little bit more on there. You can see the purple and violet on there. So I can, put this on the head, on the neck, vagal nerve stimulation, on an elbow, whatever you want. So they have handhelds and they have these standalone FXs that are their two main products. And so they have red only devices. They're red handhelds called the Accelerate. They have a red violet handheld that I just showed you, and that's one I believe Bob was using in his therapies, and that's the EVRL, the red violet combo. And the new kid on the block, there's more and more research coming out of green. So I have also the GVL, which is the green violet laser, and I'll turn that on so the audience can see it as well too. And what we're finding is each different wavelength has different functions as well too. So that's a green violet combo there that you can see. And you can't see the violet as well, but the green and violet there. So that's the GVL. And the shorter the wavelength, the more energy per photon. So when you look at the rainbow, the shortest wavelength is getting to the violet end of the spectrum. And so that's why the 405 nanometer that makes the color, that's what gives it that color to the human retina. That's what makes it, the violet is the most energetic. Green is the next most energetic. It's in that 520 to 532 range. The Erchonia diodes are 520. And then red is next with respect to the laser spectrum, and that's in that 600 range. Like Erchonia uses 635 nanometers. So the shorter the wavelength, the more energy. The more energy you put into a cell, the more output it has with like ATP and Krebs cycle and all that stuff. So it's been really neat. Like the laser industry actually started in behind the Iron Curtain in Hungary, at Heidelberg University. The researchers they shaved rats. They were thinking this red light was gonna zap these rats and cause tumors, cause cancer, all this stuff. And what they found is when they put red 635 on the rat, not only didn't it cause any of those negative effects, it actually made the rats live longer. It made them healthier. It grew their hair back faster and all these things. So they completely shifted the research into turning it from, hey, we're going to zap somebody with a negative effect into, wow, these are therapeutic. So in Russia and all these other like Eastern Bloc countries, red light, like 635 laser, is a primary treatment modalities in the medical industry. And then when the Iron Curtain dropped, all the Western research was like, oh, wow, we're way behind in this research. So then it started to gravitate over into the United States and whatnot. So that was kind of the origins, was all based on red. But as we're looking at different colors, we're seeing, hey, each color may have a different effect. I think a really good example is a lot of your audience will be familiar with, how we sterilize things with UV light. like medical instruments, and you go to med spas and stuff. Well, UV light has very good, the ultraviolet light has very good antimicrobial effects, like taking out pathogens like bacteria and stuff. Well, it turns out violet light does all that. But the problem with UV light is if you have too much sunlight, for example, it can cause free radical damage and things like that to mammalian cells. But if you're in the visible light spectrum of violet, you get you get those good antimicrobial effects like antiviral, antibacterial, but you can do it safely on human tissue. So then we're combining like red and violet together to not only do, really well with pain and things like that, but even in antimicrobial stuff. Like you'll see in studies going after, the herpes viruses, like, the Epstein-Barr, herpes simplex 1, things like that. They even did COVID studies on this stuff. So it's really neat in the arena of immunology as well too. So we're starting to expand. It's not just about pain management and aesthetics. We're seeing realms being used in immunology, in anti-pathogen stuff. Like, one of the big things we see in Alzheimer's and neurodegeneration are even your dental, gingival stuff, like the Prevotella and Porphyromonas, all these pathogens that create these biofilms in the teeth, like even MRSA, that flesh-eating antibiotic-resistant staph. Red and violet laser has been shown to take out MRSA. And I could go on for hours just on the antiviral, antibacterial stuff, but it's neat. The more we're finding, the more energy per photon, the even better effects. Like red did really good in all of our double-blind pain management studies, but when you added red violet, it did even better. And then when you add green violet, it does even better for pain management. So it just the main take-home point is red is still the kind of the meat and potatoes of laser therapy, but when you add red, violet, and or green, now you're expanding even more into those arenas.
So you really answered my next question I had really well already, but if you want to dive any more into it, what are some other treatment options, or how has laser therapy evolved since you gave me the origin story now?
Yeah, so the origin really was about pain management. Like one of the things that impressed me about Erchonia is like, I think they're up to, light devices have 26 FDA clearances now. Erchonia has 22 of the 26 last I checked. 22 of them, they have more FDA clearances than all light companies combined. And because they're really putting resources into, and these studies, like these pain management. I was the principal investigator of the chronic pain study, for example, that we did on the FX635. And it knocked it out of the park, statistically speaking. It does really well with chronic and acute pain. Like a lot of the audience that's working with, whether it's acute ankle sprains or chronic pain syndromes, chronic back pain, chronic neck pain, acute neck pain, shoulder pain, things like that. Erchonia has FDA like double-blind randomized placebo-controlled studies, which are like the most rigorous of all the FDA clearances. So we use multi-site, like typically at least 3 locations. And I mentioned earlier, we use the LED as a placebo. I don't know what the patient gets. They don't know what they get, whether it's the true laser versus the sham LED. It's randomized association and distribution. It's like the list just goes on and on. So they're very strict studies on outcomes to show the efficacy of these devices. And so pain management is going to be your most common thing that both chronic and acute. But I think like one of the latest FDA clearances was post-operative pain and recovery. Decreasing the need for medications, improving recovery time, things like that. That was one of their most recent clearances. And they've got all kinds of research in the pipeline as well, too. So we're getting more and more into the field of neurology. We're getting more into like autism and looking at it from a Parkinson's and Alzheimer's and things like that. So you're seeing that whole arena branch out. That we're still way early on in that. But even looking at when you look at in vivo and vitro studies, what we're seeing with the neurodegeneration stuff, the evidence is overwhelming there's so many studies now on Alzheimer's and whatnot, not necessarily Erchonia studies, but in the laser industry in general, you're seeing more and more in the neurodegeneration realm. The aesthetic field is big, on body circumference reduction, weight changes and working on, love handles and things like that. I think one of the questions I saw was collagen, like the new Emerald that Erchonia has, the green body contouring laser also has an FDA clearance for collagen and the pop marks and things like that. So it's the aesthetic field is a whole other arena that you're seeing light therapies. Anti-aging stuff. You'll see a lot of med spas using light devices for like wrinkles and different things like that. So you see a lot of different branches coming off of light therapy, but really at the end of the day, the most common thing you're going to see is for pain management.
Sure. So you talked a bit about what happens at the cellular level early on when you're introducing it, but how does it really promote healing?
Well, I think, again, it kind of ties into that initial answer because healing needs energy. And so the more energy you can give a cell, the more it has to work with to heal the tissue, whether it's a muscle tear, whatever a stroke where you've had a nidus of an infarct or that kind of thing. You need oxidative phosphorylation. You need redox reaction, like that whole oxidative system, like the glutathione we were talking about and stuff, the free radical mopping up and things of that nature. You need inflammation initially, but you need to turn off that inflammation. You need to mitigate the fibrosis and scarring. And that's another huge benefit of lasers is to stop that process. Again, you need that initial healing process, but you don't want those adhesions and long-term fibrosis because that can, when we're doing, say, in physical therapy rehab and we don't have proper joint motion because the muscle tissue isn't getting to a certain, it's not able to expand past a certain range or whatever. Yeah, we can work our way through that stuff, but lasers can help prevent that excessive buildup of fibrosis and scar tissue, but B, help overcome the limitations of that. So that's another big thing is the inflammation and scar tissue reduction at that level is going to be a big thing with orthopedic conditions all the way on through to brain injuries, for example. So yeah, there's at a cellular level, I think the energy output is going to be the most linear answer to that, but then you can start to see all the other effects at a physiological level as well too. So.
You're not going to quiz me on this afterwards, are you?
If you want me to, I will.
Yeah. No, thanks. I'll need about 6 months to study, and then I'll get back to you. So you talked about 10 joules. That was referring to wavelengths, correct?
Dose, actually. So wavelength is the color, and that's baked into the device. So if it's red, it's typically going to be somewhere between like 630-ish up to about 830 nanometers. If you get longer than 830 nanometers, you start getting into these longer waveforms that you see that are really designed to heat tissue. So these infrared saunas, or if you go to, not that you would eat fast food, but if you went to a fast food restaurant, you see that red hue that's keeping the food hot. Those are heating devices. And the next layer up from that is microwave. So you don't want to get too long of a wavelength because all you're doing is vibrating water molecules to heat it like a microwave. So that's why we want to stay typically in the visible, the red end, or below into the violet. So somewhere between 405 nanometers and 830 nanometers is your ideal sweet spot for light devices for therapeutic purposes. If you want to heat stuff, then keep going longer and more powerful. But again, I'm always careful. I would never stick my head in a microwave and turn it on. So I'm kind of, leery of when you start getting too high powered with these longer wavelengths. But then you're going to hear terms like, like the Erchonia devices. These are milliwatt diodes, milliwatt. Well, these higher powered class 4 devices can get up into the 40, 50, 60 watt range. And that's power, folks. That is like just cooking tissue. And that's why they have their their FDA clearance as a heat lamp, not as a laser. And again, I'm not here to knock anything. I'm not here to throw a class 4 under the bus, but I sure as heck don't want people shining a class 4 on somebody's head and cooking it kind of thing. So when I'm talking dose, like 10 joules per centimeter squared, that's taking a low powered device, like a milliwatt device, or in the low end of like the, 200 milliwatt, their Erchonia is 17.5 and 7.5. That's why I can leave it on for an hour or two if I want. Not that I need to, but I could. Versus a 40 or 50 watt device. Plus, if they leave it on longer, that's going to increase that, and the size of the beam and stuff, that's going to increase that joules per centimeter squared thing to way over the hormetic threshold. So the bottom line is to stay below 10 joules per centimeter squared, use a low milliwatt diode device, and you don't need the long lengths of time either. It's based, the benefits of laser are not based on power, it's based on the energy per photon, and that's built into the color, with the violet, red, and green we were talking about.
So aren't like the level 4s, those are more in actual medical places and you have to be like certified to run them?
Yeah, and you have to have, radiation department coverage. All people should be wearing protective eyewear. They shouldn't have open doors in the office. And yeah, if even further to that, you even get into the surgical lasers that are designed to ablate tissue, like zap tissue, because they're so powerful and that kind of stuff. That's a whole different, that's that other end of the spectrum. So again,
Sure.
I'm not trying to do that on somebody's head, or even I'm even careful on dose timing and parameters. Like if you're using a class 4 laser, I really beg of the audience that they're not just taking the keys to the Ferrari and driving 200 miles an hour and not knowing how to work a stick shift kind of thing. It's like, I want them to know how to calculate dose and do all the reading you can on literature, peer reviewed stuff, what their FDA, like ask the companies, what is your FDA clearance for? And, and they should disclose, what they actually have it for. And again, most of the companies it's going to be based on a heat to a tissue for temporary relief of muscle and joint pain. It's not for all these other things we're talking about today.
Sure. So what are the most common medical conditions treated with low-level laser therapy? I know we mentioned neurological conditions, pain management, but are there more specific ones?
Well, I mean, as you look and pour into the pure, like there's over 16,000 papers on PubMed now on laser therapy.
Jeez.
And so if you start pouring through that, again, that will kind of overlap my prior answer about pain management being the most common one. And that can be neck pain, shoulder pain, elbow pain. Really, when you look at laser, almost every orthopedic condition has research backing it, whether it's TMJ, elbow pain, whatever, knee pain, all the above. But yes, you're seeing the neurodegeneration thing really start to take, no pun intended, but to shine, like the benefits that you're seeing in the research on Alzheimer's being the most common one, but any of the neurodegenerative stuff you're seeing. Neuropathy, diabetic neuropathy is a good example. You're seeing light devices and laser just doing really well in that stuff. So pretty much any peripheral and central nervous system condition, you can make the argument in some way, shape, or form. There's research backing it. I like it in immunology because we're seeing so many of our patients are in chronically inflamed states because of chronic inflammatory conditions. Whether it could be something like a common one, like Hashimoto's thyroiditis, all the way on down to more complex things that are less common. But you're seeing light devices being good in that immunomodulatory stuff for affecting thyroid function, but again, staying in that safe low end kind of thing. For other autoimmune conditions like MS, there's a good example that has research behind it and how lasers have been shown to actually been in studies to reverse the demyelinating effects of multiple sclerosis and whatnot. So you're seeing it in medical pathophysiological conditions, as well as all that other end of like pain management and optimization stuff.
So what can you use in conjunction with laser therapy? Are there other modalities you may use or other things you look at? I know you talked about in the beginning your whole outlook on everything, but do you want to get into any specifics?
I love that. That's a great question, Mike, because it's like lasers can replace a lot of things and you can use it as a standalone and like do literally like set it and forget it. Like when we did the chronic back study, we would just pop this device down on the patient's low back and leave it on there and walk away kind of thing. So they can be a set it and forget it modality, but I'm big on stacking stuff. Like say your audience, a lot of the physical therapy is doing like a active release technique or some sort of myofascial thing or, something, a stretching move. Well, what you'll find is when you stack the laser in conjunction with that, you'll get even better outcomes, say of the, eccentric elongation or something, or of the range of motion that you're doing, or maybe you're doing a vibration device or a balancing technique or something. I'll put the laser on while I'm doing whatever other modality I'm doing, and it just gets even better outcomes. Or say I'm working with, Olympic athletes or something, I'm working with hand speed and hand-eye coordination. Maybe I'm lasering their prefrontal cortex and cerebellum while they're doing those activities for optimization. So I will use lasers in conjunction with pretty much every other modality, and I'll stack them together and get even better outcomes. And even the fatigue ratios, like as you're working with patients and they start to conk out, you'll find you get better metabolic substrate and capacity while if you're doing lasers, they'll be able to do the rehab longer before they start going into anaerobic phase, just as another example.
Have you seen people improve their hand-eye coordination with lasers on their head while doing multitasking?
Yeah, exactly. So I'll do it as a proof of concept a lot of times. Or like another good example that will kind of overlap that umbrella is that I'll have patients say they have a positive cerebellar sign, like on their bedside neuro exam where they're having like that terminal dysmetria. And then I don't touch them. I laser their cerebellum and they go like this. And they look at me like, what the heck did you just do? Because all I did was get that energy into the cerebellum and do proof of concept pre and post outcome. Same thing with range of motion. Say they're doing like a goniometer with an orthopedic test, like a cervical rotation or something, and they're stuck at a certain place. And then I laser them and they have an increase in 20 degrees range, whatever the range of motion increase is. And that was without even doing any physical therapy, chiropractic, or anything on them. So yes, you will see those kind of things. And it's kind of fun to do that stuff. Or like say you're doing QEEG assessment and looking at brain wave activity, and there's maybe at high beta, overactive, and they're like OCD and ADHD and stuff. And then we do like a 10 hertz laser setting on them to calm that brain down. And you see it in real time on QEEG assessment where those hot spots in the brain calm down into an alpha state. So yeah, you can see in real time really cool objective pre and post outcomes just by lasering the whatever target tissue.
I think I need a laser at home for all my kinks and aches and pains. I'm gonna go hang out at Bob's house. He's got one.
Yeah, I was just gonna say, I think you could hit Bob up for his there too. So yeah, you bring up a good point because more and more people are actually like I just had an intensive leave today. They flew in from Alabama this week to get treated, and they're gonna buy a laser for themselves at home.
Ah, yeah, fascinating. Yeah, I feel like most. I mean, I come from a therapy background. Most therapists have their modalities they like, and they just kind of stick to it. It seems like, but I mean, I think they all have their own place.
I do. I love shockwave. I love microcurrent. I love all these devices. So it's not necessarily they all can work simultaneously. I love the audience to look at like whether using laser versus or over top of using those modalities together. And again, the more you stack stuff, the better your outcomes are going to be.
So what does a typical laser session look like, and how long does it normally last?
Well, I mean, the most I'll ever put typically on a laser patient, like on maybe a chronic low back or something, is 20 minutes. But that's the longest typically I'll use laser. You don't need that length of time. Like say I'm doing brain rehab and I want to do prefrontal, parietal, cerebellar or something. It's usually like 2 minutes kind of thing, maybe a couple minutes over the gut. So most of my laser sessions are no more than about like the 10-minute mark would be a good average number to talk about. So sometimes a little bit less, sometimes a little bit more, but it doesn't have to take up a lot of time. And another thing to keep in mind is because things can all be pre-programmed with all your favorite protocols and stuff, the staff does a lot of my setup. I don't necessarily have to take up my time doing it. It's not that I don't. I love doing stuff in real time myself while I'm doing, brain-based stuff with patients. But my staff does a lot of set this patient up for X, Y, Z, and they know exactly, put it here, and you're off onto your next patient. So it doesn't have to take up a lot of your time as the primary provider in your office.
So are there any risks or side effects associated with laser treatment?
Yeah, I mean, this is the kind of the it's interesting because the FDA, when they look at contraindications for laser, they clump all light devices under the same umbrella. So they'll put a class 4, a class 3, a class 2 all under the same contraindications. So in the strictest form, the FDA contraindications are retina, pregnancy, cancers. You can't use high-powered devices over a titanium hip or a tattoo or something because you can burn them. There's all these things. Well, that's the higher powered class 4. They're doing studies with low level laser on retinal repair. You would never say that about a high powered laser. I have no issues using a low level laser in any of the those situations, like an Erchonia and that kind of thing. That's me talking. That's not the company talking. I always want to be responsible, especially in mediums like this. You always want to err to the side of caution, but apples to oranges comparison, like a class 2 laser, like an Erchonia versus a class 4, the typical contraindications are not the same for an Erchonia, even though they have to abide by those FDA limitations. So I always want to make sure med legal wise I'm being responsible when I'm educating people, but just know there's a big difference in the literature and in what we see clinically on when you use what you can safely use a class 2. I can use an Erchonia device over a tattoo because it's not thermal. It's not going to burn them. But a higher power device, you can burn that patient, So that's just one example of many. So always err to the side of the FDA clearances, but just know there's a big difference in those devices.
Sure. So in order to administer low-level laser therapy, do you have to be qualified or need any special training? I know people can kind of just buy the devices on their own, can't they?
Yeah. So that's the thing is with these low levels, like a class 2, like an Erchonia, I prescribe it to patients all the time to take home and show them how to use it and the protocols and things like that. But so no, you do not have to have some special certification to get a light device. You do not have to have that. But again, I beg the audience to do their homework as far as if they are going to dabble into the high power class 4 end, please study dose, study what happens in higher dosing, study the negative effects of the higher, when you're up in these high joules per centimeter squared and stuff, because they're not all created equal. So I always ask my audiences, challenge what I'm saying. Read the literature. I've read over 3,000 papers on low level laser therapy. I think if I welcome everyone to get into this arena that isn't, but just understand that hormetic Goldilocks effect and try and get a device that stays safely in that parameter. So.
Sure. So are there any recent advancements in laser technology?
Well, I think the biggest thing you're seeing as kind of the newer end is the different colors, because the red was pretty well established over the last, since the 60s, really. But with the newer colors, like the green is the new kid on the block kind of thing, we're seeing exciting things happen with, like, the violet was next after red, and now that we're seeing the green, that's probably the most exciting thing that we're seeing. And that because these different colors, because they have even more energy than red, that's why we're seeing even better outcomes with pain, for example. Even in one treatment, what we saw with the green violet combo compared to red was substantially, red did great with like a single treatment for neck and shoulder pain. Any pharmaceutical would love to have these outcomes with what we're seeing with that stuff. But red was good, but red violet was even better. Green violet was, like I said, so each time you add more energy into the system, we're getting even better outcomes. And then we're seeing things like each color might have a specific strength that, like green seems to be the best for bone healing. It's not that red and violet don't have an effect on it, but green's even better kind of thing. So you can start to see little nuanced things as we study each color. That each can maybe add another layer to something that was slightly different than, or slightly better than before. I never want to throw red under the bus because that's still always going to be the main light device. But it's kind of cool to see these other colors and what they're doing. So that's probably the newest area. And I think the biggest thing is neuro research, the brain-based stuff. I would definitely read everything I can on that. Like, look, that's my area of specialty, if you will. So it's really exciting to see what they're doing with Alzheimer's and Parkinson's and all the neurodegenerative stuff. And I would definitely implore the audience, like if you ask me, Trevor, I want to protect my brain against neurodegeneration like Alzheimer's, what's the one thing I should do? You can always make arguments like move, exercise. That's always going to be a major thing. Stress reduction is always going to be a major thing in neurodegeneration. Leaky barriers, leaky gut, all these things are big players. But if you said, I only want to do one modality to protect my brain, it's going to be low level laser to the brain below 10 joules per centimeter squared. And that's my number one defense I can offer for my patients and myself, my family members, that kind of thing.
I'm assuming in the last 30 years, the devices have gotten a lot smaller compared to the original ones.
Uh, yes and no. I mean, the diodes, it kind of what they put the packaging in, but the diodes have always been pretty small. So
Oh,
it's not, yeah, it wasn't like the old computers that had like
yeah,
the
they're
IBM
huge.
or something. It wasn't that big of a change on that stuff. But yes, obviously these handhelds are very efficient. I travel with this one. I'll put it in my carry-on, things like that. Obviously, I'm not traveling with this big boy right here, but so yeah, they're what I like about it is because with the pre-programming stuff, you can like preset literally. I think the new GVL, you can do 100 presets. So you can do like the master brain setting, the acute pain setting and stuff. So all that stuff is pre-programmed in. So your staff literally, like this one, chronic injury, I just hit that green start button and it's off and going. You can just hit one button and have a preset for whatever your chronic pain, acute pain, depression, whatever setting you want to put in there. And you can load like this one, you can hold 100 different presets. So that way you just hit one button, it's all pre-programmed and the staff does it or you do it. And it's really easy. You're not sitting there programming a bunch of stuff in every time with patients. You just hit the start and go kind of thing. So
Did you say you pack that thing in your carry-on?
I do. I take lasers with me all the time with my
Yeah.
handheld. So
What does the security say when they see them?
I just got asked that question by one of my patients. Surprisingly, I thought they would have been giving me grief because I lecture internationally. So I've taken it all over the United States. I've only ever had one TSA agent go, "What is that?" And so what I do is I just bring the brochure of what low level lasers. I say I lecture for it. That's what I just say. I'm taking a light device that's for my pain kind of thing. And they,
Sure.
I thought they would have given me more grief and question it. But thankfully, I've never had that issue with TSA. So
Sure. I suppose people bring little video games and laptops all the
yeah,
time.
exactly.
So my last question is, what should patients look for when seeking laser treatment?
I think the big thing is just knowing to use the lower end of the spectrum. So that the misconception is that the if low level laser is good, more power must be better. So I'm not here to throw any particular technique or company or anything under the bus, but I just don't want patients thinking that if low level is good, higher power must be better, especially for sensitive tissues like brain and all that stuff. So and look for the ones that are most researched. Again, look at the FDA clearances, the Erchonia. They have their doctor locator on their website, so you can see most of the Erchonia providers that are in your area. If you pull up their website, you'll see a list of who all is in your area that might have an Erchonia device. So that I think that's a big thing is stay on the low level, the cold laser end of the spectrum. Look at who has the most research behind it. And those are the two biggest parameters that I would look for.
I guess one thing I kind of forgot to ask was when people are using it, is it something they would use daily or numerous times a day, or how often do they use them?
Yeah, you could. Again, when you're in the low end of the spectrum like that, like my intensive that fly in to see me, for example, I'll see them kind of all day long at my office. And for a week, well, they're typically getting laser like all three of their primary sessions that they're with me. So, like I said, I could do hours and hours with these devices and not exceed threshold. So, yes, with low level, I do laser every day on myself. Every day. That's what I do at lunch. I meditate because studies have shown that laser increases gray matter in the hippocampus, like your memory center. So does meditation. So I combine the two. I do meditation on my lunch hour as part of my reset, if you will. And that gets me ready for the next day. But if I do a laser rental program where say they have an acute ankle sprain or some injury like a surgery or something that they're healing from, I send them home or their family member home with one of these handhelds and they'll do the laser, say 2 to 3 times a day to help expedite the healing process. So there's ways you can use that and safely use it multiple times a day. There's a cumulative effect with lasers. Like when we do the chronic pain studies, we do 1-year follow-ups, for example. So it showed like when we did the chronic back study, for example, we stopped the treatment at like 4 weeks. Well, when we did the 8-week follow-up, the true laser group, their pain still continued to improve. the sham placebo group and went to go back to baseline where they started with pain. And then when we did the 1 year follow-up, the true laser group maintained those gains kind of thing. So those are just examples of there's a cumulative effect too. So it's kind of like one of those things where, yes, you could do it every day, but even if you're getting it once a month, once a whatever, it's still going to have benefits and confer protective benefits versus not doing anything at all.
Sure. Well, is there anything I forgot that you would like to mention?
Well, I tell you, we took a pretty deep dive into light therapies, maybe a little bit too much for some. I think the biggest thing is the fact that more and more providers are recognizing this technology as being it could be a big benefit. I always tell people this is that you don't, and this is not to sound dismissive to our patient base, but I always say you invest in a laser for your own brain and your family. Your patients just get to be the benefactor of it. So, invest in that thing to take home for your own family members, your own brains, your own aches and pains, things like that. You take it to the office. Yes, all your patients could benefit from it, but invest in it for your own protective mechanisms, your own well-being. One of the big things for me is my first laser device was because I was developing psoriatic arthritis so bad in my hands and wrists. And I was trying everything, all the chiropractic, physical therapy, everything I could think of. It was actually light devices, the laser, that got me back, because I had to quit martial arts, golf, working out. I couldn't even finish a day in practice. I don't do as much like standard chiropractic because of my neuro bias now, but all the adjusting stuff and whatever, wrist pain and finger pain and stuff. And it was actually low level laser therapy that saved my hands and wrists. And now I'm back to doing all that stuff. So, I'm just a walking example of how you buy a device for yourself and then use it on your patient base. So, just try it out. That's one of the big things is look at those, like I said, those pre and post outcomes with whatever your specialty is. If you're doing all physical therapy, orthopedic stuff, look at their pain levels, see their pre and post outcomes. A lot of the docs I know just do like a one treatment challenge. They'll say, hey, let's get this light device on you and your pain's an 8. Let's see how it is after and the day after. And patients come back like, wow, that thing got me down to a 5 or whatever it is. Or like I said, their shoulder range of motion, you put the laser on it and then it goes up higher after, like, wow, that feels a lot better. I do an upstream pain treatment thing. This is going to be too complex, but I'll just mention it because pain starts to centralize in areas of the central nervous system. That's another reason why I treat brain, even with like a chronic left knee pain, for example, because as that pain starts to integrate into the areas of the brain and brainstem, like the reticular formation and the amygdala and the parietal lobe, and that's all too technical, but all these parts of the brain, I'll use lasers to regulate the upstream response. And so one of the things, that when you look at pain centralization, the more you can affect pain in the newer, like the neocortex and all these central areas, the more you can affect a chronic left knee, for example. It's not that I don't laser the left knee, but I'll laser up into here to change the functionality of what's going on down there as well too. Now I know that's for we'll do that different podcast on the advanced neuro stuff applications, but those are the kind of things I teach too at my seminars. And I get physical therapists, chiropractors, naturopaths, medical doctors that are more integrative. I get all kinds of different healthcare providers at my seminars because we come at it from all because one area of interest I can say emphatically is you line up 100 patients and say, hey, are you interested in protecting your brain? You're gonna get 100 people say, yes, I am. Okay. Or as I always like to joke, that one person that says, no, I'm not interested in protecting my brain. Well, they need laser on their brain probably more than anyone else, that kind of thing, right? So that area, I don't care what the specialty is, everyone has an interest in brain function. And even in the orthopedic, physical therapy, chiropractic realm, affecting how the brain works is going to improve your outcomes with a knee rehab, with a chronic back condition, or whatever. So there's brain applications in any kind of specialty in practice. So this is another reason I love to kind of teach the brain first approach, because it will have a beneficial effect no matter what you're doing with your patients.
Sure. I understood your brain anatomy a lot more than your cellular stuff earlier. So
well, good. That's the most important thing, because if you can understand brain pathways, then man, that's such an underserved area of healthcare. So.
All right. Well, thank you for joining us today. Do you want to mention where people can find you at again?
Yeah, absolutely. Again, my seminars, most of them are listed on Erchonia.com under the seminar schedule. My website is www.azchironeuro.com. We do our Arizona Chiropractic Neurology. We have Facebook and Instagram. I'm not a big social media guy. I love what you guys do and getting that message out. I think I have 3 Instagram posts. So if you're looking for content, I got to do a better job of that. But I lecture all throughout the United States. Definitely come see one of my seminars. They're super intense. I pack a lot into those 2 days. Typically, I'll be doing stuff like I'm on stage coming up with the Vibrant Longevity Summit, like with Mark Hyman and a lot of those kind of names for anti-aging. I'll be all over the United States and international. So again, if you go to Erchonia.com, you can see a lot of that schedule. So,
well, thanks again for joining us.
Absolutely. Thanks for having me, Mike. And you guys are doing a great job. Thanks for the message and the education you guys are providing. So